evening. Let's go live with consultant dermatologist Dr Mary Sommerlad, who I met at a couple of events recently, and we've never created content together. She's gone to work alongside Dr Angeli Marto, who is, as you well know if you follow me, one of my all-time favourite consultant dermatologists, at a brand new clinic called Self. So we'll be chatting a little bit about that as well, but let me invite her in, shall we? Where are you? Oh, that's interesting. Angeli comes up first. If I put in Dr Mary, she will come up. I'm sure she's the only Dr Mary I follow. Hello, Angeli. When I put in doctor, you were the first thing that came up. Also, we need to talk. I think I'm going to get you on this morning with me, chatting SPFs. Where are you? Hello.
Hello. Hello. Hello. Good evening.
How are you?
I'm good. Thank you so much for having me.
My absolute pleasure. I have been trying to create content with you for so long, and then luckily I met you at two events back to back, and then I strong-armed you.
Not at all. It's literally my absolute pleasure, and I'm so excited. I have more than 10, but I will streamline and explain.
It's interesting, isn't it? People often think it's just 10, but actually it's just things you absolutely love, and depending on how quickly you can go through them, some people choose 10 and some people get through about 30. So, but let's start with I called you, and I don't know if it's patronizing to call you that, but a relatively newly graduated clinical dermatologist, because you seem very young to me. But I mean, you can't technically be a consultant dermatologist and be young because it takes so long to train. So tell everybody a little bit about your background and how you also came to partner with Angeli, who I adore.
So thank you for the huge compliment. I actually started my training in dermatology in 2012. And yeah, a couple of years ago.
Her advice, people.
And I qualified as a consultant. So a consultant dermatologist is someone who's done all the dermatology training. I am on a GMC register, which is our the equivalent of an American board certified register. So I joined that register in 2016. So although I like to think it was yesterday, it's 7 years now that I've been a consultant dermatologist, and 11 years that I've been in the world of dermatology. So for anyone who doesn't know, dermatology in the UK, you go to medical school, you do 4 years as a kind of general doctor, physician in a hospital, and then you subspecialize in dermatology for at least 4 years. Some people go off and do a PhD, some people do all sorts of things, and then you become a consultant. A consultant means you can independently work. You can work in private practice, you can work in the NHS, many do both, and it just means that you are very accountable. So what you are practicing is evidence-based dermatology, how the General Medical Council would expect you to do. So that's where that kind of consultant dermatologist, it's equivalent to board certified. And my story with Angeli actually goes back to about 2000 and I think it's 10. Angeli's sister Artie was my registrar when I was an SHO. So when I was a junior doctor, we were both junior doctors together. And I would say, I really want to be a dermatologist. And she would say, my sister's a dermatologist. So we go back a long way, but we've recently started working together at South London. And it's been fantastic. And Angeli is just such a brilliant mentor and a brilliant colleague and a wonderful friend. So that's how we work together. And
you're the dream team. You're my new dream team. I've decided that if I've got any questions at all, I was in it this morning today, and they want to go down to the beach and do a thing about how you should look after your skin in the sun and how research shows that most people don't. And I was like, I need Angeli. Like, get her on a bus down to a beach with me. I didn't ask her first, so I hope she's going to be up for it. She's just putting her heart emojis. I presume that means that she's up for it. Anyway, so tell me a little bit about South London as well, because I saw you at an event, and then I saw you at the launch party, obviously.
So the exciting thing about South London is we are consultant dermatology led space for not just managing skin in isolation, but as part of your whole self, hence the name self. So we know that people who have skin conditions can also have quite a huge psychological impact with that. So we work with a clinical psychologist, Dr. Eleanor Chapman, who's wonderful. It's also at the event, because we know that there's a big relationship between what's going on with our mind and what's going on with our skin. And it's bi-directional, actually. So stress can make maybe your pre-existing eczema or acne worse, but also having a visible condition can have a huge impact on your self-confidence, your well-being emotionally. We also know there's a big relationship between your gut and your brain and the skin axis. It's something that we're learning more and more about. So we also work with a registered dietitian, Dr. Rini McGregor, who is just fantastic. Has worked with the Olympic Team GB. And the idea is you get a holistic approach to looking after your skin. So it's not just, this is a cream, use it, good luck. It's also asking all those questions around your overall well-being.
Do you have a specific interest for skin, or you do? Because I mean, obviously Anjali is incredible at acne. She's been on a personal journey, and I feel like she owns that space so brilliantly because of that personal experience. What about, is it for you? Do you have a specific area of interest or not?
Yes. So I have, my big interest at Self is pigmentation. So things like melasma, which I think is such an undertreated, underappreciated on its impact on someone's condition. These are, for anyone who doesn't know, it's the kind of patchy dyspigmentation, usually on the cheeks and the forehead, much more common in women. It can happen to women during puberty, during pregnancy, during any stage in life, really. It can be very tricky to manage, but it can be managed. And at Self, we have lasers that are suitable for all skin types, which is another really important passion of mine, which is dermatology and skin of color. So I love all skin types, but I think skin of color is often neglected, especially when it comes to pigmentation issues. And it's really, with looking at melasma, it's not just this is the cream or this is the laser procedure, but it's also the how do you maintain that improvement in your skin and what's actually causing the skin. And we'll talk a little bit about that with some of the sunscreens and things like that.
It's very interesting, isn't it? Because it's only recently that I've become aware of the fact that most dermatology training and textbooks are based around skin my color. So it's so hard for a dermatologist who hasn't been trained in all skin types and tones to know how to identify certain conditions in skin your color. And that blew my mind.
Yeah.
It's in a way, I know it's completely superficial in comparison to what you do, but standard hairdressing training only trains people to cut my kind of hair as well. So no kinks, no coils, no curls. Yeah. And that also blew my mind. So I feel like for your generation, it's kind of like, you know, a sort of breaking ground on being a much more inclusive, both medical practice and industry as well. I really do.
I completely agree with you. I think it's really important that if you are someone, whoever you are, whatever your skin color, whatever your where you are in your journey in life, the dermatologist you're seeing is comfortable in making your diagnosis and then also giving you management options. So there might be some treatments that aren't appropriate, but we should also be able to say these are what can help. And I think that's really important, that everyone's treated as equally as possible. So at Self, we have our laser, which is fantastic for not just pigmentation, it's also scarring, acne scarring, as we alluded earlier with Anjali, but also we can treat rosacea. We can treat rosacea topically, orally, but also with the laser. So our laser is our big friend because it can do so much. Also, when it comes to pigmentation, it's not just things like melasma or post-inflammatory hyperpigmentation, but also freckling. And it being summer, we know that freckles, especially if you're not, even if you're very careful, to be honest, in the sunshine, if you have very lightly pigmented skin and you're freckling easily, or even for a short period of time, even if you're wearing sunscreen, you might be left with marks on your backs of the hands, the neck, the face that are really difficult to treat. Again, we have the laser that can help with that.
You being polite calling it freckling, I call it sun damage and age spots, but that's just me. Are they different? They are. I always think of freckling as something you're sort of born with, that children have.
No.
Whereas
So,
I don't think you can politely call this freckling.
well, so funnily enough, they are part of the same thing. If that children who freckle, usually it will be because they have skin that is susceptible to freckling. They tend to have lightly pigmented skin, blue eyes, fair hair, red hair. If you think of the typical kind of Celtic fair redhead, you can have two redheads, both 10 years old, one who's had meticulous sunscreen, and very often they'll be Antipodean, so Australian, Kiwi, South African, where there's this really strong messaging about being really protected and wearing the sun hat and the full light sleeves. And they may have very few freckles. You might have the equivalent child who's covered in freckles. So we now really recognise that freckles are a response to sun exposure. And we know that most of us get most of our sun exposure in those first 20 years of life. And those sunburns are really crucial for risk factors for skin cancer. So we talk about sunscreen a lot as dermatologists as part of aging, but actually it's also prevention of or reducing the risk of skin cancer, especially if you freckle. So it's always, and I always say as well, even if you identify as having black skin or skin of colour, if you still freckle, if you have lightly pigmented eyes, if you have a parent who's white European heritage and you're freckling, that's a real sign that you need to be really meticulous with your sunscreen, regardless of how you identify.
I think that's the fundamental difference between my generation growing up, where we didn't have SPF. I mean, genuinely, when I was a child, my mother, I don't think the product even existed, and then becoming a teenager and then being in my 20s, and then I look at the way my friends are raising their children, and it's fundamentally different. Right, let's dive in. Do you want to start with SPFs?
We could start with SPFs, definitely. So SPF refers to sun protection factor, and that's your UVB. You'll probably hear me say sunscreen a lot because UVA is super important when it comes to the sunspots or aging or freckling. Also really important when it comes to pigmentation issues as well. So if you have dark marks left from, say, acne or eczema, it's really important that you use something that has a very high UVA rating. If you have melasma, visible light protection is even more important, because we know it's the visible light. So that's the light on when the sun is out, even if it's cold, even in December, that can really drive pigmentation. So I've done basically my personal things. And I was texting you earlier saying I've lined them all up.
I love it.
But I'll also mention some things that I don't have with me. So what SPF did I use today? I used Medik8. I love this Advanced Day Ultimate Protect. It has a really high, so UVA is not universal, the ratings. Sometimes you'll see a star rating, especially if the product is being sold in Boots.
Yeah.
5 stars means the highest UVA rating. If it's not sold in Boots, then it may have something instead called a PA factor, which is a protection from UVA factor. And 4 pluses is really important there. And then in other countries, sometimes you get something that it's really difficult to understand. If it's something from the EU, usually it will have a circle around the UVA, and it might just say something like very high protection. I love this because it's really moisturizing, and I get eczema, I have hay fever, I'm very atopic, so I want something that's quite moisturizing, doesn't leave a white cast, has a really elegant finish to it. And I will often use this in the summer with no moisturizer underneath, whereas usually I'll moisturize throughout the winter and then put a sunscreen on. But I think that this is personally, for someone with dry skin, reactive prone, works really well for me.
Can I just say also, that's my one piece of advice to anybody. When I did a piece on this morning about it as well, I've just written a piece for the Times that comes out on Saturday, is if you don't want another step, just skip your moisturizer and use a really moisturizing SPF, because it's easier to get the level of protection you need. And they're so beautifully formulated now that they've got all the glycerin and hyaluronic acid and antioxidants anyway. So
absolutely,
brands don't want you to say that, but really a company like Medik8, I mean, it's perfect.
Absolutely. So you've spot on. If you want to streamline things, I always say, really, like, if you're someone who's like, I don't have time for a skincare routine, I say in the morning, just think of your antioxidant and your SPF, and in the evening, a retinoid. That's like very basic 3 things, and then everything else is a bonus and will help you, especially if you have targeted concerns. That would just be a fundamental. So my morning routine, I will use, when it comes to cleansers, I don't really stick to one particular brand, so I'll just show you what I'm using at the moment. In the morning, I'll use something really just light, basically to take off my retinol from the night before. And I'm very much in the habit of, I use a cleanser in the morning. Lots of people don't want to, especially if they get tight skin or any issues around that. But I think personally, I like it. I super cheap and happy, super drug, vitamin E. It's again, I like it because it's great for dry skin. I have dry skin, and I tend to look for things that don't really foam, and I love a balm. It may be too much if you're very blemish prone. On the flip side, it's being rinsed off quite quickly, so you can
love it.
Play around.
I think it's a brilliant product. Absolutely
great for the
so
price point. What it does, I use it with I'll use it again in the evening, but this time with a flannel and after removing makeup, which I'll go through.
Somebody just asked a question, which I feel like I answer it the whole time, but I feel like it's nicer if it comes from a consultant dermatologist. What's the difference between an SPF, dedicated sun filter, sun protection factor, and a moisturizer with SPF?
So that's a really great question. When it comes to testing your SPF, your sunscreen, there are specific, someone like Boots or big trustworthy brands that are buying in lots of different sunscreens will test what you say on the package is what is actually happening in real life. The test for that is actually using quite a lot of sunscreen. It's 2 milligrams per centimeter squared, which equates to, it's different for different, how big your head is, basically, and whether you have hair on your scalp. We always want you to also go down to the top half of your chest and also back to the hands. The amount that is tested to give you a true, say, SPF of 50 is usually more than the amount of moisturizer you would be using.
So with foundations as well, people.
Absolutely.
They're top-ups, yeah.
Absolutely. Think of them as top-ups or kind of cherry on top of the cake, but really to get your actual sun protection, you need a dedicated sunscreen, which is why I say if you're really stretched for time in the morning, your SPF's the #1 thing. Like, even forget your antioxidant, but your SPF is the thing that can reduce your risk of skin cancer, can reduce accelerated aging, and can help you if you have a lot of dark marks left over from any kind of pre-existing skin condition. So it's not just you're using SPF as a fun part of the routine, it's really helpful. When it comes to moisturizers, makeups, anything else that has a bit of SPF in it, you may not be getting what you're expecting. I
simply just don't think, I always say you cannot apply enough moisturizer. You would be left thick and oily and gummy, and heaven knows, hello, Dr. Wasim, literally you could not apply enough foundation. There's just not enough foundation in the world. I put a pea-size amount of foundation on my face, and you would need 2 runs of fingers for your face, 2 more for your head, 2 more for your neck. I mean, you would look like a clown if you wore that much foundation.
It wouldn't leave you with a nice finish.
Don't use them as your primary. Sorry, I interrupted. What lovely, okay, so I'm fascinated to know this. What antioxidant do you love every morning after you cleanse?
So I've got a couple, and I usually will rotate. So when we come, why antioxidants? It's pollution. Pollution and sun work together to drive inflammatory skin conditions and also pigmentation problems. So that's why an antioxidant is useful. The commonest one will be your vitamin C. Another good antioxidant is azelaic acid, which a lot of people don't realize will also work as an antioxidant. So if you're on a prescription azelaic acid, you don't need an additional vitamin C as part of your skincare routine. At the moment, I'm going to sound like I don't work to medicate. I literally
Tetra.
It is sea Tetra. I do love it because it's really hydrating. I will go through them. So sea Tetra is what I use this morning, but I also, and it's vitamin C, so that's a vitamin C leave-on. I also really like Dr. Sam's Brightly, which has the azelaic acid and niacinamide as well. and it just goes on really nice. So I'll use a cleanser, pat dry, and then I'll get my antioxidant on as the first thing that I'm using.
Do you tend to avoid a quite high strength L-ascorbic acid because it's too irritating for your sensitive skin?
Irritating for me, so I look for lower concentrations, and I love
the
formulations
Medicate
as well.
C Tetra is a C ester, isn't it? It's not, you know,
So absolutely, when it comes to your antioxidant, we don't want you to go through a lot of pain for your gain. So if it's tingling, if it feels uncomfortable, just stop or reduce the concentration, or look for something where it's maybe formulated with other things that make it more acceptable to your skin type.
The two you've chosen are a perfect example. They really are. Yeah, absolutely.
And I'll use them on separate days. So I'll never use them together. I'll use this today, I'll use this tomorrow. You don't need to overload your skin or overlay. I'm a big fan of just keeping things really simple. So it's one antioxidant, and if it's a formulation, so if it has additional things like niacinamide, perfect. Helps with soothe if you have like easily irritated skin, if you have pigmentation issues. And niacinamide's also an antioxidant as well. So one of the reasons why I like Brightly is because it's got a bit of niacinamide in it as well.
Ollie coming in there and asking what's better for melasma, vitamin C or azelaic acid? Or can you use the vitamin C in the morning and the azelaic at night?
You can do. There are clinical trials which show that 20% azelaic acid twice a day has some equivalence to using hydroquinone.
Wow.
But that is prescription. That is a prescription.
Okay.
So over the counter, I would say it depends on your azelaic acid. You'll struggle to find anything above 10%. With your vitamin C, depending on how high concentration you can tolerate, you also don't want to use too high concentration and it irritates your skin, because then you'll drive some post-inflammatory pigmentation changes.
Yeah.
So I would say try azelaic acid first, but also, always more important than any of that is your sunscreen that blocks visible light. I don't have it with me, but I love Color Science because it comes in different shades. So it's a SPF 50, really high UVA protection, but it blocks out your visible light, which is really important for melasma.
Color Science, the powder one?
So it's actually, I think it's called something like Flex. Comes in a bit like the Medicate tube, with a little pump, and it goes on as a cream or a fluid. There are other tinted sunscreens. The reason they're tinted is because iron oxide has a rusty red appearance, which doesn't look good on anyone. So if you put a tint in, it becomes more cosmetically acceptable. There are lots of companies that also have like a universal blend. And I always have a really open mind with the universal blend. There are some brands that have a universal tint, and I'll use them and I'll look absolutely fine. I'll be really happy with the finish and it's great. But my friends who maybe have slightly lighter skin, but still skin of color, so maybe more brown or olivey, it'll make them look orange. The same universal tint that will suit their skin might not suit mine. So I always say try before you buy a universal tint, but don't write them off.
Yeah, I wore one the other day, and towards the end of the day, I looked like Donald Trump, and I was like, what? And it had oxidized during the day, and I was just going more and more orange. I kept
and nobody tells you. Nobody tells you. So you kind of walk around and, you know,
looking like I'd been tangoed.
Yeah, absolutely. So definitely try before you buy, but don't completely write off. I think it's always a good idea to try first. Yeah. After my antioxidant, if I'm wearing a moisturizer, so full disclaimer, I work in consultation with a few different skincare brands. Vichy is one of them, but I genuinely do love this moisturizer. It's really lovely. It's Mineral 89, which is like their hero serum, but in a cream form. So it goes on as a moisturizer. It's got niacinamide in, bit of squalane, lots of hydration. It's perfect winter months, autumn months, or if you just are having a bit of a, you know, through the winter, you just need a moisturizer, and maybe your sunscreen you like your sunscreen, but it isn't moisturizing you enough. So, and the other thing to say, I think that's really important with skin, and I often say this to my patients, your skin's really dynamic. So you might find at some parts, you might have 3 weeks where your skin is perfect, and 1 week where it's really dry or it breaks out. Not necessarily related to hormones, but there might be other things going on in your lifestyle that will affect your skin. So don't feel like the moisturizer that you have to always stick with one type of moisturizer or one type of sunscreen. You might have something that suits you really well 2 weeks of the month and something else that you need 2 weeks of the month, or different months. So change.
Totally agree. Also, what I love about that Vichy moisturizer is you can use it morning and night. So you
Yeah.
can sandwich it with a retinol if you're new to
Absolutely.
retinol and stuff. It's a really good sort of perfect all-round hydrating moisturizer. I think it's a really good one.
Really
It's nicely
nice.
formulated, that. Yeah.
Really nicely formulated. I'm going to talk a little bit about eyes, because I don't usually recommend specific eye creams.
You literally just read my mind. Okay, so most dermatologists are quite skeptical about eye creams, aren't they?
We are, because we all say it's all one skin type, and actually if you can, the skin here is much thinner and we do have specific issues around here. I always say, if you like an eye cream and it's something that part of your routine, perfect. If you wear a lot of concealer and you don't want to, maybe you want something much heavier under the eyes and more hydrating, or any particular eye issues, then something hydrating around the eyes is really important. But I will use my moisturizer, so the same moisturizer that I put all over my face, I will use up to the lash line. And
I use my vitamin C, my retinaldehyde all around.
Yeah. Yes, you could do. So you don't need to specifically buy one, but if it makes you happy, or you feel it helps your skin, or it's a specific eye cream, maybe you have very puffy eyes in the morning and you find that you've got a caffeinated eye cream that makes you feel that your eyes are brighter. Perfect.
That, I was going to say, my exception for that would be a caffeinated one. I absolutely love that. If I've got to do morning TV and my face is really puffy, especially one with the cooling tips, they're so nice.
Absolutely. I will sometimes also, so I get hay fever at the moment, so my eyes might be looking very red, and I'll use an eye cream where it's just like almost like cooling. So it's part of that, just cooling and calming, but not necessary. But if you like it, perfect. I'm going to speed up now because I'm like so
no,
I'm loving like.
So you don't have a specific eye cream that you would recommend?
Do I have a specific? I don't particularly. All I would say is, if you want to use an eye cream, what are you using it for? Does your moisturizer maybe already fill that box? And if it doesn't, then something with caffeine is usually helpful. And there are so many out there, and you can just kind of make up your own mind. But there isn't one that I kind of would routinely kind of use. I have to mention body care very quickly.
Yes, of course.
Just because being someone with eczema, I have to moisturize twice a day, otherwise my skin will go wild. I love La Roche-Posay, Lipikar, really one of my favorite moisturizers, and I'll use it top to toe. And I'll do that in the morning after I have a shower, and I'll do it in the evening as well. I'll usually have a very short, quick shower in the morning. You don't have to wash twice a day at all. If you have to choose one, go for the evening rather than the morning time. But I love just a very quick shower, and then on slightly damp skin is the trick for your moisturizers. You want to get them on and always go downwards. Don't do lots of rubbing up and down, because you might trap the hairs on your body. You get little bumps everywhere. Throughout the day, especially if this kind of weather, if I'm wearing dresses, or maybe I've got shoes that are backless, you can see my feet and they're drying through the day, I like something to spray on. And I've got a couple of different sprays.
Oh, I love a spray on body lotion as well.
Eucerin, I love this. Aquaphor. I like the balm as well, it's great on the lips and for any kind of chapped areas. But this is the Aquaphor in spray form, really good. I was going to show you my foot, you probably don't want to see that. But it's great for if you're just walking out and about, flip-flops, you just want to make the heels look tidy, or your shins look tidy, you can spray it on. And you know,
I was going to say that thing where you suddenly look down and you go, oh my god, ashy legs, quick spray, when you're already dressed, right? I know.
Absolutely.
Love it. Absolutely love it.
Big fan of that. The other one, and I have another spray, and this is a not that guilty a pleasure, but I love the L'Occitane one. It smells nice, it's very light.
Which fragrance do you have there?
So this is the it's the almond one, which is for anyone who knows L'Occitane, their almond oil is like a big product of theirs. It's very hydrating, and this is kind of like It's very, very light, but it smells nice. And you almost don't need to rub it in. So it's just like a bit of a fun thing. Goes easily in the bag. I always mention sprays and moisturizers for the body because I use a lot. And I feel like sometimes people think, what do you put on your body? Sometimes you kind of skip past that. So then hair, very quickly. So I have Afro textured hair. I will basically, what do I do? On a day I haven't washed my hair, then I really rely on a leave-in moisturizer. And I love pattern.
Oh, okay. So I did a live with a wonderful woman called Mia Mojay the other day, and she introduced me to pattern.
Yeah.
It's Tracy Ellis's Ross's range.
Yes,
it's
Diana
to the UK. I think it's just landed at Boots extensively, but you can get it in Sephora. So tell me, so is that a leave-in conditioner?
This is a leave-in conditioner. It is, I would say, to be honest, if you don't even have to have Afro textured hair. If you have curly hair or dry hair, it's always the holy grail to find something that conditions your hair, that doesn't leave it looking kind of weirdly limp or oily or doesn't kind of sit well. This is just super light. I will basically put a little bit of water on my hair, or spritz a bit of water, and then I'll scrunch this in. And it contains something that I never... I wonder if it's jojoba, which I never thought would do anything for my hair. I was always a bit like, I'm not sure. But it's just really lovely and leaves it really soft, and it's really light.
I've heard nothing but good things about that range. And for me, it was new to me, but supposedly it's so successful in Boots now that they're beginning to stock the entire range as well. And I think that's brilliant news.
Really hard to find in Boots because usually it's all sold out. So
it's
a
the
really
flagship
great...
You can now get it at Sephora, so you can get it online.
Perfect.
So that's Pattern, P-A-T-T E-R-N.
Yeah, Pattern.
Tracy
I
Ellis
think for the calc, Tracy
yeah.
Ellis Ross. And then, so I'll use a bit of water, I'll use a cream, and then an oil. And this is my hero hair oil product. It's Charlotte Menzer, incredible, inspirational woman. Charlotte has used the Manketti, which I think is a nut from Ghana. She is of Ghanaian heritage, and it's just a really lovely oil. A little goes a long way, so this will last months and months and months and months. And I'll do this especially towards the ends. If my, the ends usually will get dry and crispy throughout the day. On the days I've washed my hair, I love this L'Oreal Elvive. It's hyaluronic acid for your hair. I think it works really well in all skin types. Not skin types, hair types, but it's really great, I think, especially if you have textured hair and you maybe are washing it twice a week onto damp hair. It's just really nice and hydrating. It's a really nice slip, and I really, really love it. And it was a new find for me.
It's really clever because honestly, it works on my hair, and I've got fine, not very thick hair, very kind of, I've just had a Brazilian blow dry, but normally it's just a little bit textured. It's really clever. And actually, I'm sure they don't want me to say this, right? Okay, but I don't think the hyaluronic acid actually does anything. I think it's marketing. It's microscopic waxes put into lamella technology that coats the hair.
Well, whatever is in
it works,
whatever they have done, it works, because I think it suits all her hair types, and it doesn't feel tacky or heavy or anything. So I'm really like enjoying that. And very quick deviation, I thought, but I just thought I'd mention kind of some.
No, and I love the fact that it's available from Superdrug and Boots and everywhere. Yeah. And I love also that it suits completely different hair types as well. Yeah. I mean, the thing about L'Oreal is they share the same technology as Redken and Kerastars and L'Oreal Professional, so they just get hair like they get SPFs. They do. They're very good.
It's great, very available. And then the last bits. So what do I do at night? If I'm wearing eye makeup, then I'll always remove that with something dedicated for eye makeup-y things. This is especially the waterproof mascaras, things like that. And that will be a personal, whatever suits someone use. I'll always use reusable cotton pads as well. Then when it comes to how do I actually cleanse it off? Love Rose Ink, the Micellar.
I was talking about it on This Morning today
Oh,
because
you know, I haven't seen this.
because you've got a job and you're working really hard looking after people. Scarlett Johansson has just launched a range called Outset, and there is a micellar gel in it. And I said, oh, and Holly Willoughby went, ooh, I've never seen a micellar gel. And I was like, oh no, Rose Inc.'s got the original one. And it's so much better than a micellar liquid, right?
I love it. I think it really, it has, I'll just quickly show what it looks like. You can see how much I've used it. It has this little pump action. So you just push down, smear over with your cotton pad, and then I just put it all over. And it just feels lovely. It gets everything off. So even if I've worn full face makeup, it's really nice.
And the thing about a gel is, you know, when you use a liquid, you kind of put it in your hand and it gets through your fingers and it soaks the pad and you feel like you're overusing. With a gel, it's really measured, so I feel like it goes further. It's more comfortable on the face. I love the micellar gel.
I really love it, and it was a new thing. Like
she was the first, as far as I know. Correct me if I'm wrong, followers, but I think she was the first. She was brilliant.
Really nice. And then I'll go back to my trusty balm just to get everything off.
And yes, of course you can use it around your eyes, Michelle. Of course you can, absolutely.
Yeah, absolutely. And I keep going on about my eyes. I think it's because I've had so much hay fever today. I have really sensitive eyes. And
there's a pollen bomb. There was a doctor on this morning talking about it. We're in the middle of a pollen bomb.
Oh gosh, yeah. But it doesn't sting, it doesn't make anything redder, so it's nice. And then I come on to my retinols. So if you ask a dermatologist, and if anyone ever says, oh, what's the number one thing after SPF? Because everyone will always say SPF, it will always be a retinol because it just does everything you want. Everything you want. It is your exfoliant. It helps with pigmentation issues, helps with blemishes. It can plump up collagen, so it can help with fine lines. That's just so brilliant. So I'll use lots of different retinols. So I'm not particularly like stick to one brand. I don't use a prescription one.
Neither do I. You're the only dermatologist I've ever met that doesn't use a prescription one. Tell me why.
Unless I need it. And that's because I have such sensitive skin that even on the lowest prescription concentration, it can cause irritation. So the few times I have used prescription, maybe I'll do it twice a week. Consistency is always key when you do a skincare routine. So I know that if I use especially retinaldehydes, fine, I can use them every night. I'm very, very happy. You don't need to push up to the highest concentration. You just go with what suits you. Go with a formulation that suits you.
Going back to your argument about vitamin C, if it's irritating your skin, the best retinol or retinoid is the one that you will use consistently. For me, it's a retinaldehyde, and I've never got on with prescription ones. I'm sure Angeli would love to get me on an extra strong.
You know what? With a prescription one, there are always lots of tips and tricks. And maybe that's for another day, but you can sandwich with your moisturizers. You can have skip days. Things are really bad, you can rinse off. But I always feel like maybe if you're getting results with something over the counter that suits you and you're happy, perfect. And that's kind of what works well for me.
What have you got hidden there?
So what do I have hidden? At the moment, I'm going back to my dear friends, Medicaid. Retinal.
Love Crystal Retinal.
The Crystal Retinal. This is the one around the eyes, which I love because it does not irritate your eyes, especially if a lot of people had really bad experiences with we call them retinoids.
Yes.
The commonest ones are your retinols, and retinols can be very irritant at high concentrations. They can be absolutely fine at lower concentrations or on someone with different skin. So everything's very individual. Retinaldehyde is actually more potent than retinols, but tends to be more gentle on the skin. So, and more companies I think are doing retinaldehydes now. So you can definitely, if you've had a bad experience with retinol, try retinaldehyde. Lots out there. I like this around the eyes because it's also got the ceramide, so it's very kind of.
What strength is that, Mary?
So this is 6, which is kind of like
in the middle.
I'd say middleish.
It's very interesting. There's a theory, and I don't know if it's true because genuinely, I think retinaldehydes are relatively new. That it's the the metabolism, the metabolic pathway of the retinol to the retinaldehyde with the enzymes in the skin that they think causes the irritation. So that's really interesting. I'm like you. I've had problems with retinols. I've never had any problems with retinaldehydes.
And with retinaldehydes, I've been fine. But I'm dabbling, and I do like to dabble from time to time. This isn't going around the eyes, this is going on cheeks, jaw. With any skincare, I always bring it down to the upper chest. And I think, you know, and the neck.
Very wide.
Always the neck. SkinCeuticals Retinol. It's pricey. It is strong. I'm not using this every day, but I do like their retinol. And this is the 1%.
That's the 1% one, isn't it? Yeah.
But it's a nice one. If you have, I wouldn't start with, if you're new to retinols, I wouldn't start.
I wouldn't either, yeah.
This would be really, really harsh. But if you are happy to sandwich, and which I'll often do with going back to my Vichy, put it on first, and then get your retinol, and then you can reapply again. The highest strength retinol will still be lower than what you'll get on a prescription.
Yeah.
And the last thing to say is don't be afraid of a prescription. If you see a dermatologist, they recommend trying a retinoid for either a skin disease or preparation for a procedure. Explain you've had bad experiences in the past, and we'll spend a lot of time trying to get around them. And that's really it. So retinol, retinaldehyde around the eyes. I'll often, before the SkinCeuticals, I was using the Manketti at 6 all over the face as well.
I used the 20.
Oh wow! So you'll be fine.
I'm old enough to be your mum now. Been around the block. Somebody asked just very quickly. Yeah. Makeup. What base do you wear? Because your skin is glorious, Mary. Have you got makeup on at the moment? So, what do you love?
I have got concealer on, but I don't have any base on.
If I'm look at the skin. Go on.
So the concealer I'm using at the moment, I should have brought it up actually. It is the Laura Mercier, and it's a stick. I really like a stick concealer, which is really difficult to find. If you have any suggestions, because I loved Marc Jacobs. Yeah. Marc Jacobs had the best concealer ever, and they kind of just vanished. And I have just like a tiny stub, which on special occasions.
I think, is it still available in the States? You might be able to get somebody to send it to you from the States, but I'm not sure if the entire brand has gone. But there are rumours that it's coming to Net-a-Porter. Okay. So I think it's just had trouble distributing in the UK. Oh, wow. So you like the Laura Mercier stick and then the Marc Jacobs stick?
Marc Jacobs stick when you could get it.
Okay.
And that's what I'll put under the eyes. And the Laura Mercier is the one that has like the correction. So there's a brightener and a corrector as part of the stick, and that's what I'll put under the eyes. And then I'm not wearing a base. I'm just wearing my sunscreen. If I do wear foundation, then I've got a few favourites. Something very light and sheer, then I like Armani, which I think everyone kind of. It's great, and I think the colour matches are beautiful. And then Pat McGrath, who I think designed the Armani. Oh, this is the rumour I heard from the Pat McGrath counter.
Not a rumour, she did it. Yeah, she was signed to Procter and Gamble for a long period of time, and at the same time was moonlighting, I think, a little bit on Armani as well. Oh
no. Well, if I want something, maybe if I'm out in the evening or something where I'm going to have a lot of light on the face, and I love the Pat McGrath foundations. Am I wearing anything else? No.
Her skin is just amazing. That's why.
That's very kind of you. If you'd seen it in the winter, you'd be saying, so which moisturizer should you reapply right now, Mary? You're looking a bit.
Two quick questions that came up while we were chatting. One was, what was the name of the eczema? What was the name of the laser that you can use on all skin types that you've got at South London?
So we use something called, so the laser itself is called a Joule, Joule. The manufacturers are called Cyton.
Yeah.
And then they do two things. Or the laser, basically, you have broadband light, which is amazing at treating acne, rosacea, reds, basically. Can also treat freckling, but only up to people with a brown rather than black skin tones, and the old words would say Fitzpatrick 4 to 5. When it comes to melasma or pigmentation problems, we use the halo, HALO, part of the jewel Cyton, and that you can use on black skin tones, and it will help with melasma. It's also safe to use for scarring as well, so if you have acne scarring. For anyone looking into laser, I would always say make sure the person you see is qualified to use them. There are lots of different ways of using a laser. Sometimes you might just have a day of training and that's it. You need to make sure that the person is not just has the correct training in the laser, but is aware of the safety precautions around it as well, and that they can safely treat your skin type. So do ask them, with my skin type, what should I expect as a potential complication or a potential risk? And if they say no, there's never any problems, walk away, because we spend a lot of time counselling on the risks of pigmentation change, how we would manage that. You know, accountability is so important when you go in for a procedure.
I mean, I'll jump straight in and say, when in doubt, if you've got any skin that's remotely reactive or prone to pigmentation or scarring, go and see a consultant dermatologist. Yeah. They are the best.
I would say
there's a reason they spend all that time studying.
Start off there. If you feel, because at least even with one consultation, at least you have like a really informed idea of what to do, and then you can make up your own mind of what to do next. But at least,
and often at the very large practices as well, if you see a consultant dermatologist, they, even if they don't necessarily do the treatment, they have informed the person that does the treatment on the how to set the machine up and the settings you want for your skin. I mean, if you see these machines, I can't believe it. I mean, you basically do need a postgraduate degree and whatever to work it out. They're so complicated and so amazing now. The other thing somebody said when you were talking about pigmentation issues at the top of the live we did, what about the so the white spots you get when you're sun damaged and the skin stops pigmenting?
Yes, guttate hypomelanosis.
Oh, I love that.
We call it like almost like an inverse freckle.
Yes.
You, not just on the face.
Old lady legs.
Back on, yeah.
No, my boyfriend was out at the weekend and I was like, oh, look, you're beginning to lose the pigmentation on your arm. And guess what? He used to be a bricklayer when he was younger.
Well, so lots of cumulative sun exposure. Loss of pigmentation is tricky to manage. But it's never too late to use sunscreen. Really never too late to just make sure that you are not just using the sunscreen, but long light sleeves as well, long light trousers and skirts, those sorts of things. Because
if you wear an SPF as well, then the rest of the skin around it fades and they become much less noticeable as well, don't they? The white patches. And then it might not be your area of expertise, but somebody did say, because you mentioned pigmentation at the top of the live, vitiligo.
Vitiligo. Vitiligo is one of those really, again, another Cinderella, a bit like melasma. Pigmentation's always been a bit kind of neglected, I think, in dermatology, although it's often in the top 5 reasons someone goes to see either their GP or a dermatologist or an esthetician.
Is it really one of the top 5?
Yeah, top 5 is a we call it dyschromia, so a pigment issue. And so vitiligo, we call it an autoimmune skin condition. That means for some reason your body has decided to destroy the pigment cells, which are called melanocytes. It can start at any age, but about half of the people who get vitiligo, it starts before the age of 20, so in childhood. I do a lot of pediatric dermatology as well, so I will see 2-year-olds, 3-year-olds with vitiligo. It can affect any part of the body, but it likes opening, so around the eyes, around the nose, around the mouth. It likes the fingertips as well, but it can really affect anywhere. Incredibly unpredictable. Someone might get a patch of vitiligo on their back. That's it. The colour never comes back, but it never gets bigger. It never goes away, but it never, you know, and that's it. Other people, they might get a patch of vitiligo, but then for no reason at all, it repigments, so the colour comes back. But then maybe 2 years later, they get another patch somewhere else, and then that comes back, so it can come and go. And then for a small number of people, it can be very progressive. So you lose colour, the colour never comes back, but it continues and continues. There are treatment options out there, so have hope. I see, actually not so long ago, saw a 15-year-old with vitiligo, but also came with mum, and mum had vitiligo, never had seen a doctor about it, but didn't want her daughter to go through what she had been through. And so I spent a lot of the consultation saying to the mum, please, you know, you need to see someone so you can get your own prescription. So there are treatments, usually prescribed treatments to try and reduce that overactivity of the immune system. And there's actually a ladder approach. So if you have patches of depigmented skin, so white skin appearing, do see your doctor, and there are lots of treatments, and sunscreen is also important because that skin burns really quickly.
Yeah.
And also that contrast with the tan can make the pale patch seem more obvious. So sunscreen, but see a doctor, and there are things we can do.
I presume the areas where the melanocytes have died is a very high risk of sunburn and possibly skin cancer as well, I presume.
Yeah. So sunburn, absolutely, because your melanocytes make melanin, and melanin gives you a, you know, natural, we say, protection from sunburn. That's where freckles are coming, because they're trying to
protect your skin.
Protect your skin.
Yeah.
And then after a while, if it keeps getting more and more exposure, the freckles become very permanent and stop fading away. When it comes to skin cancers, people with vitiligo are at risk of non-melanoma skin cancers. Funnily enough, they don't tend to get lots of melanomas because the melanocytes are gone.
Totally.
But you can still get non-melanoma, so your BCCs, SCCs, squamous cell carcinomas, basal cell carcinomas. So really important, especially if you have extensive vitiligo, you work outside, maybe you're not wearing sunscreen, anything new, changing, get it out.
Okay, and final question, because you mentioned that you had eczema earlier on.
Yeah.
Any product ranges that you recommend for children with eczema?
Yes, my goodness. Where do I start?
I have to say, I think the La Roche-Posay Lipikar is an amazing range.
Absolutely. So moisturizers, Lipikar is fantastic. Bioderma, Atoderm is also fantastic.
They do an amazing wash, because if you often go to an old school GP and you've got a very young child with a really chronic dry skin condition, they give you horrible aqueous cream, which is really unpleasant. They do the most beautiful, that sort of rinse off oil it's so much more pleasant to use. Really, it's gorgeous.
And I think that's a really important thing, especially when it comes to anyone with eczema, or if you're looking after, you have a child with eczema, you need people to be on board to use it. Otherwise, if you have a horrible, like a thick soap substitute that you'll never use, you won't use it, you won't see any benefit. So you want to avoid soaps, avoid bubble baths, I'm sorry. Just because the surfactant in the bubble baths can irritate and dry the skin out. We like a daily bath, actually. Keep them short, so maximum 5 minutes, because water on its own can actually damage the skin barrier. And you come out pat dry, moisturize always downwards. Eucerin as well, Aquaphor, great for especially the soles, the palms of the hands, any cracked areas. When it comes to sunscreens, Garnier Kids Protect is fantastic. Really
I always recommend that for people who've got sun-induced sensitivities as well. I always go for the kids ones, because basically anything that's remotely irritating to the skin has been taken out. Yeah,
absolutely. And it actually melts on really nicely. And they also have the sprays as well, so you know, you can make it part of the fun for a child with eczema. You know, you can spray on your sunscreen. But the main thing is using lots of moisturizer as well. So for something like this Lipikar bottle, if you have a child with eczema, I'd expect you to finish that in 2 weeks maximum. For, you know, we say 500 ml per fortnight. If you're an adult, it's a bottle per week. So moisturize, and look for something that suits you. If you've been given something, you've been prescribed something you don't like, look for something that you will like and you'll use.
And I always say, go to the section of the aisle that if you were to find Mary or I in Boots or Superdrug, we'd be shopping on that same section, which is essentially the sort of French pharmacy soft dermatology aisle, which is where you find things like Vichy, La Roche-Posay, CeraVe, Cetaphil, Eucerin. They're our heartland, those brands. And I mean, basically they've gone out of their way to formulate products that are pleasant to use for chronically dry skin conditions, including for children as well. Isn't she brilliant? I told you.
Oh,
you were amazing. Thank you so much.
Oh no, thank you so much. I literally could have gone on for hours and hours and hours. Thank
But
you.
that's what I love, because basically you're enthusiastic, but you get the feeling that you're sort of a beauty aficionado, but you just also happen to be a consultant dermatologist. You're my favourite people.
Oh, thank you, thank you, thank you.
Of course, I will save this, and it's very interesting because obviously, because Mary is a doctor, she can't come on and she can't give medical advice. But maybe if you ask some questions and tag her just about products, she'll be able to do that. But don't start sending her pictures of weird rashes. Not what she can do. You can send them to me, but you can't send them to Mary.
Oh, thank you so much. It's been an absolute pleasure.
No, thank you. I really appreciate it. And all my love to Anjali as well.
Absolutely. I will pass it on. Thank you. Have a lovely evening.
Bye. Thank you.
Take care. Bye-bye.